Good afternoon, and today we have a pleasure of interviewing Dr. Lawrence Palevsky. He's holistic pediatrician. Good afternoon, doctor.
Good afternoon, doctor. Thank you for inviting me.
I'm going to, first of all, thank you very much to our audience. And again, if you have trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can spread the word about our channel. And if you're a medical professional who, just like us, passionate about health of their patients and sleep, please use our channel as a safe networking ground to communicate with the people who I invite on the channel and between each other. Also, if you have questions for Dr. Palevsky, we're going to put information about his website on a link under the interview, and you can put the questions in the chat box, and we will find you the answers. And now I'm going to give a short story about my meeting with Dr. Palevsky. I met him at the PANI conference, and I was impressed with his lecture. And after that, I did my homework, and I researched his approach towards child health. And on a lot of intersection, I would say my opinion and his opinion coincide. And that's why I want to bring him towards our audience and ask some of the questions which personally important to me. I'm a mom of two boys, and in a process of raising them, yes, I work full time and I breastfeed them for a year and a half, and I'm a high, I really advocate breastfeeding. And I think for me personally, if you work, it should not stop. I know it's different for everybody, but I have my own journey and I can share only my experience on that. It was my goal, and I accomplish, and I recommend that, and I support my employees in that journey as well as my patients. And number two, I did not use antibiotics while I was raising my boys. I had my opinion on that. So we're going to discuss those hot topic. And my first question to Dr. Palevsky, please tell me why you don't like to use antibiotics in your holistic pediatric practice.
Well, thank you for that question. It's not that I don't like to use antibiotics. I don't need to use antibiotics because I've learned that the majority of reasons kids get sick has nothing to do with infections. And despite all of the rave of a child being sick needs antibiotics, I have determined and figured out that giving them antibiotics is often the wrong treatment, because ear pains are rarely infections, throat pains are rarely infections, coughs are rarely infections. And most of the time when children get sick, the purpose of their body getting sick is to remove an excess buildup of wastes, toxins, inflammation, and impurities that have come into their system, either through the air, through the things they put in their mouth, the things they put on their skin, information that comes into their nervous system that stresses them, and material that's injected into their body. So I understand that the reason for symptoms is not because they caught something, but because their bodies are strong and their bodies are able to understand that the maintenance of wastes, toxins, impurities, inflammation in the body is going to debilitate the body further. So the body is smart. It knows to bring that material out to the surface and removes it. And so I don't need antibiotics for processes that are predominantly the resolution of inflammation and the removal of wastes, toxins, and impurities.
I really love your answer. And the reason I become a doctor, because I have a fascination towards the human body. And I also find the human body is so much smarter than we can even understand. And, I did not talk about your bio, but I'm going to mention now, but Dr. Palevsky has a, excellent, conventional medical education. He got through medical school, through residency programs and fellowships. So he trained, he highly trained professional, but he has a lot of, I would say, critical thinking. He internalized a lot of information, and he wants to find the proof of his studies, just like me, in a clinical practice. And sometimes what we were taught in a medical and dental school, not exactly represent in the same way when you see it in practice. And practicing over the years, you can connect the dots. You can make, observations which are going to become yours. And then you practice that way. So I really like what you develop your own approach and you prove it right through so many years of experience. And I'm going to ask you, please tell me, the most common thing. As a mom, I can tell you the ear pain, chronic ear infection. What's your explanation for the chronic ear infections in kids? It's a very common symptoms, and how you approach it.
So if we look at the anatomy of the head, we realize that there's always mucus produced in the ear canals. There's always mucus produced in the nose and the sinuses. And there's always mucus produced in the throat and the intestines. And so there are also always bacteria lining the ear canals, the sinuses, the nose, the throat, and the intestines. And so one has to ask, if we're not sick, what are those bacteria and what are those mucus particles doing there when we're well? And the reason they're there is because they help to protect the body from material that goes into the sinuses and the nose and the ear canals. And they help the body to remove wastes that are coming out to the surface through the sinuses and the ear canals and the nose. And so I'm aware that there are always bacteria there. And I'm aware that there's always mucus there. But the problem happens when there's too many wastes in the body that come up through the sinuses and just exit through the ear canals. And that material is almost always secondary to dietary choices that are inappropriate for the child. The problem also is that children have very horizontal ear canals. And so the ear canals, when mucus increases in production to remove the wastes that are coming up through the linings of the head, that fluid has a more difficult time draining because the ear canals are not more diagonal, which is what we see in children as they get older. Plus, in the ear canals, when the ear canals open into the back of the nose, then the body meets the adenoids. And the adenoids can obstruct the drainage of the fluid out of the ear canals. And the adenoids will only get big, again, if there are inappropriate dietary choices. And many of our kids are fed inappropriate foods and inappropriate beverages. And so what happens in the intestines is inflammation is produced when the foods are inappropriate. And the response in the body to get rid of inflammation is to produce mucus. And so there's a nice little pathway that runs from the intestines right up to the lymph nodes in the head, including the sinuses and the nose and the ear canals. And so remember that the body always needs to get rid of wastes. Too many wastes, too much mucus. Too much mucus, ear canals can get clogged. Ear canals get clogged, it hurts. And so the real problem with ears and ears hurting is not infection. It's thick mucus, inflamed adenoids, maybe even spasming of the muscles around the ear canals that close it off to drainage. And then, of course, enlarged adenoids. And so the answer isn't removing the adenoids. The answer isn't putting tubes in so that the fluid will come out of the ear instead of going in and draining into the back of the nose. The answer is, what are the inflammatory materials that are coming into the child that are creating such an amount that excess mucus has to be produced to get rid of the wastes? And every time I'm able to encourage parents to change the diets of their kids, the fluid buildup goes away, the adenoids are reduced, and the children get sick less often. Because I'm able to explain to parents the only reason children really get sick, especially in the upper respiratory tract, is because foods that are put into the digestive system are inflaming, they're mucus producing, and they even may cause immune reactions that lead to the production of wastes. And again, the body has to get rid of wastes. And one of the pathways to get rid of wastes from the intestines is through the head and the neck, through the sinuses, adenoids, tonsils, and ear canals.
This is amazing answer. And I know we here, my channel devoted to sleep. And the reason I invite Dr. Palevsky, first of all, I want to raise the future generation healthier, what parents understand how all mechanisms work. But second of all, I think, I'm sorry to say that, but I put bread on my table treating sleep apnea patients because they were treated in a different way, unfortunately, with a lot of antibiotics, eating, very, I would say, toxic food, addictive toxic food. And, in the childhood, they formed that memories towards the, donuts and fast food. And then later on, they end up as my sleep apnea patients. But I see direct connection between that with every single patient. So thank you very much, Dr. Palevsky, for those words of wisdom.
We have to remember that we live in a culture that teaches you that your health is unrelated to your diet. So you can go to a pulmonologist, and the pulmonologist will tell you that the foods that you eat have nothing to do with your development of cough, mucus, difficulty breathing, wheezing, or asthma. And then you can go to an ear, nose, and throat doctor who tells you that the size of your tonsils and the adenoids and your production of mucus and fluid in the ear have nothing to do with the foods that you eat. And then you go to an endocrinologist who tells you that it doesn't matter what foods you eat as long as you control your insulin if you're a diabetic with the right amounts of measuring short-term and long-term insulin. So we live in a culture that tells you, eat whatever you want. Your health is unrelated to that, and we'll just give you the medication you need so that you'll feel better. And, I'm sorry, but you've been sold a bad bag of goods if you actually believe that the foods that you eat have nothing to do with the quality of your health. And so we are in a sort of an evolution of consciousness where we're able to start teaching parents that ear, nose, and throat, and lung, and skin, and intestinal, and neurological issues may all be related to the kinds of foods and the amounts of foods that you give to your kids.
No, but this is so true, and I see what it's true every single day. So I'm going to ask you a practical question. How, as a holistic pediatrician, you incorporate different approach to treatment. But I want to talk about how, we talked about that before, conventional medicine and alternative medicine, how you combine them together. I really like that portion about history and the symptoms and your view on that.
Right. So, there have been times over the last 25 years that parents have accused me of not practicing conventional medicine anymore. And I really laugh when they say that, because every patient I see, I utilize my conventional medical training. What does that mean? I take a thorough history and I do a thorough physical exam. Those are the principles of how to begin practicing conventional medicine. So I ask everything: diet, sleep, history, medications, supplements, vaccines, school, social, physical, dentistry, everything, stool habits, hobbies, personality. I'm asking all of that so I can get an understanding of who the child is and what brings the child to develop the symptoms that I might see. And then I do a physical exam. And then I do something called a differential diagnosis, which is, how do I understand what are the factors that are contributing to the development of the child who I see in front of me? So I'm looking to see, are there dark circles under the eyes? Is the nose congested? Is the nose swollen? Is there fluid in the ear? Are the tonsils big? Does the tongue have a white coat on it? Is the child mouth breathing? Does the child leave the tongue at the base of the mouth, instead of using the tongue up against the palate to talk? I'm looking at muscle tone. I'm looking at weight. I'm looking at distribution of fatty tissue. I'm looking at the eye contact. I'm looking at the kid's ability to relate. So I'm looking at all these things to understand the level of health in the child. And then I come to an understanding of what are the contributing factors that are bringing the child to those symptoms. My job is not to suppress the symptoms. My job is to understand what's contributing to them so that the parents can be educated how not to have those symptoms any longer and how not to need to go to the doctor any longer for the development of those symptoms. Because you can actually control the appearance or the disappearance of those symptoms. So when I have kids who have wheezing or asthma, and we identify that there are one or more foods that they're eating that are creating the coughing, the wheezing, the bronchospasm, the mucus production, the inflammation, the trouble breathing, the difficulty breathing, the irritability, and they remove those foods, and then all the asthma symptoms stop for months on end. And then the child eats that food and goes right back into an episode of wheezing, coughing, mucus production, inflammation, trouble breathing, irritability, loss of oxygen. The parents know it. It's their learning. It's the kids learning. They now know that they can avoid the development of their symptoms. They can make their symptoms not appear by making the dietary and environmental choices that are going to keep the kid healthy. And so those experiences give the family full ownership. And then they can monitor how much do they really want to be on nebulizers? How much do they really want to go to the ER? They can make those choices, and they can understand that they have the power to make those choices.
My question to you, like you explained very good approach towards asthma, and I can tell you as a dental sleep medicine, dentist who treats sleep medicine, most of my patients put asthma in a, in a history, in a medical history, and I don't know, it's a real asthma or that type of, maybe they had one episode which related to anaphylactic reaction to certain food. It's really hard to say, but most of my patients do have those symptoms, and then they end up with stuffy nose, with the wrong tongue position. Besides controlling the diet, do you have any other recommendation for people who, have kids with asthma or who suffer from that disease?
So because I understand asthma as an illness that presents itself as pretty much an anaphylactic reaction to either something that the child ate or drank or something that the child breathed in or put on the skin, I know that my job to do what's called alternative medicine, which is outrageous that we even call it that, is to understand the factors that are contributing to such a level of inflammation that the only way the child could deal with that inflammation was to develop the cough, wheezing, and the episode of asthma. But, there are other ways to support a child who has wheezing and asthma episodes, and that's to make sure that we don't give them acetaminophen ever, because acetaminophen is a chemical in the body that will deplete the human body of its production of glutathione. And anybody who can read, anybody who can think, and anybody can add 2 + 2 can figure out that reducing glutathione in your body by taking acetaminophen will worsen asthma, will worsen allergies, will worsen eczema, and actually will worsen any chronic disease, because glutathione is needed as the most important antioxidant and the most important chemical in the body to help the body detoxify. And why do you get symptoms in the first place? because your body is needing to detoxify. Your body is needing to cleanse an accumulation of too many wastes, too many toxins, too many impurities, and too much inflammation. And by taking acetaminophen, you are taking from Peter and giving to Paul. You are essentially removing glutathione from the body at the moment when the body most needs its glutathione. And so one of the things you can do is to stop using that over-the-counter drug so that you can allow your body to keep its stores of glutathione adequate. And you can also either use dietary supplements to increase your glutathione production. So there are glutathione precursor supplements. There's also N-acetylcysteine. And then some people actually do benefit from taking L-glutathione, cetriaglutathione, or even liposomal glutathione, which can help to maintain the stores of glutathione. Because remember, when you have too many wastes, toxins, inflammation, and impurities in your body, you really need your glutathione. It's not a healthy thing to put chemicals in your body that are going to deplete your stores of glutathione at a time when you most need them.
That's a beautiful explanation. I would like to ask you regarding allergy. What's the common source of allergy, and if you send people a lot for allergy testing?
Okay, well, first of all, there are a lot of ways to detect allergies. If you go to a conventional allergist, you're going to get either skin test or blood test. And if the skin tests are negative and the blood tests, which only check for what's called IgE or immunoglobulin E, if those tests are negative, the allergist is going to tell you you're not allergic to that food and you can go ahead and eat it. So if you go ahead and eat it and you vomit that food, or you have stomach pains, or you have diarrhea, or you start coughing, or you develop wheezing after you eat that food, you know that you're still allergic to that food, but it didn't show up on a blood or a skin test. Your allergist may tell you, no, you can eat that food. It's okay. You don't have an allergy to it. But your body experience is saying, excuse me, doc, but I can't eat that food because my body is rejecting it. Because the main processes that happen in the body is it must get rid of anything that threatens the safety and the integrity of the body. And the development of symptoms is to do that. So if you're having a reaction against something that you're eating, you're allergic to it or you're sensitive to it. But just because the allergist said it's negative doesn't mean that your body isn't using other mechanisms of making sure that your body reacts so strongly against that food that you get rid of it as quickly as possible. So where do all these allergies come from? Well, it depends on whether you want to do a deep dive into where these allergies are coming from. Because if you hear from the conventional world, they'll tell you, oh, it's from poisons that are on the food, it's from pesticides, it's from changing of the genetic structures of the foods, it's from dirty air pollution, it's from using poor skincare products, but they will not tell you the one reason allergies have increased over the last 30 years. And that reason is vaccines. Because your doctor is not going to tell you that food proteins are present in the vaccines. If you pose that question to your doctor, hey doc, why are there food proteins in the vaccines? Your doctor is more likely to say, don't worry, there's such a small amount of that food in the shot that it's not going to make a difference in your health. But guess what? What are the most common food allergies that have risen exponentially in the last 30 years? Dairy allergy, which is an allergy to casein, one of the two proteins in dairy, gluten allergy and wheat allergy, egg allergy, soy allergy, nut allergies, and peanut allergies. And lo and behold, if you do a deep dive into the vaccine manufacturing process, you will find that dairy, gluten, eggs, soy, nuts, and peanuts are found in the shots. So even if a small amount might be in the shots, as your doctor might say, as a way to dismiss its relevance, that small enough amount may be strong enough for the other materials in the vaccines to ignite an immune response against those food proteins sufficiently to make you now allergic or sensitive to those foods. And so, because of the way the vaccines are structured, those food proteins are more likely than not going to cause the immune system to develop a massive immune response against the foods, so that you're being taught through those vaccines to see those food proteins as enemies. Then you eat them, and guess what your body does? It mounts an immune response against those foods, causing inflammation, and then causing your body to do whatever it can to get rid of it. Cough, mucus, vomiting, diarrhea, rash, eczema, even ticks, and even seizures, and even bedwetting are all evidence of the body's attempt to respond in a way to get rid of those food proteins, because the body has been introduced to them and they are in need of being rejected and removed.
Thank you very much. It was such a, I learned so much wisdom, and a lot of things which were known to me become clear. So thank you very much, Dr. Palevsky. And again, for our audience, if you want to learn more about Dr. Palevsky's wonderful philosophy, you can check his website and you see the link, and you can put the questions for him and we'll find you an answer. Thank you very much.
Thank you.